is Naima Lawson, and today we'll be doing an NG tube insertion and removal. The date is November the 15th, and the time is 1:36. I've already set up all of my things that I need for this procedure. So now I'm going to walk into my patient's room, I'll wash my hands, and I'm going to provide privacy for my patient. And then I'm going to explain my patient's procedure to the patient and also introduce myself. Hi, my name is Naima Lawson. Today I will be your nursing student and we will be doing NG tube. And then I would explain the procedure. I would also check my patient's wristband to make sure that the name and date of birth match what I have, and he verbally tells me what it is as well. After that, I can put him in high Fowler's position because that's the position he needs to be in, and I would also raise the bed. Okay. Next, I would put on clean gloves after I start setting up all my other things. I need a towel because just in case the secretions come from. So now that I've placed my towel on my patient, just in case extra secretions come out of my patient's nose, I'm going to start setting up my other stuff. I'm going to start setting up my tape. I will need 4 pieces of tape. And I do this without gloves because it's a little tricky. One piece of tape I'm going to split in half. And then I'm going to roll the pieces under like pants. And this will be easier when I'm trying to remove it. Then I'm going to put some jelly on my towel so that I can lubricate my NG tube. And then I'm going to wash my hands. And then I'm also going to check to make sure my patient, which nose I'm going to put it in. I want to make sure that's the one that he can breathe the best on. So I would check and let my patient breathe in. So we're going to do this nose, our left. And then I can put my gloves on. So now that I've got everything set up, my tape and my jelly, I'm going to measure. Starting at the tip of the nose, going down by the ear, and I'm going to stop when I hit the epigastric region. That's about right here. Just so I don't forget, I'm going to tape it so I do not go too far. Pause it. So next I'm going to take my syringe and I'm going to pull it back to 30 cc's of air, and I'm going to attach it to the NG tube. Because now when I attach it at the end, I'm going to push the air in so that I can make sure that the NG tube is far enough. I'm going to put on my stethoscope. And then I'm going to lubricate my NG tube very well. At this time, I would see if there was any other nursing student that could help me, because I would like my patient to drink water as they get the NG tube in their nose. So I would tell my patient as I'm going in to take sips of the water. So now that I have my student nurse to help me, I'm going to insert my NG tube, and I'm going to tell my patient 1, 2, 3. As I'm inserting, I'm going to walk my fingers in, and every time they're going to give them the cup so that they can take a sip. When I get about halfway, I'm going to lift the neck so that there's an easy access to the tube down to the body. And when I get to this point, I'm going to stop. Now that the NG tube is inserted into my patient, I'm going to tape it using the one that looks like pants. Put the tape down the middle, the bridge of the nose, and wrap it. And then I'm going to secure it with once it's attached to my patient, I can put on my stethoscope and I can add my 30 cc's of air. After I hear this sound. So now after I put in the 30 cc's of air, I'm going to also pull out a little bit so that I'm going to aspirate a little bit so that I can put it on my pH scale. When I take this off, I'm going to place it in there. I'm going to hook this together. Then I can take my pH scale and I can take whatever was in the stomach and put it on the pH scale, and it should be between 0 to 4. Then I'm going to tape everything up. I already know that my NG tube was not coiled because I used my pen light. Now I would attach the NG tube onto my patient. In the hospital setting, there would already be a pin on my patient, but since we're just simulating this, there's not. I'm going to fold back the tape just so that it's easier to take off when I need to. And I'm going to tape this on the patient, and then like I said, there would be a pin to attach it. Thank you.
1, 2, 3.
My patient is in the right position for removal. My gloves are already on because I've already washed my hands prior to coming into the room, and I've already did patient privacy as well. So this is my towel that I'm going to take my NG tube and place in when I remove it. I'm going to remove the tape from my patient's gown, and then I'm going to remove the tape from my patient's nose. I'm going to peel back the sides first. And then I'm going to tell my patient 1, 2, 3. I'm going to pull it out. Pull it in my hands and wrap all of it into the towel. The NG tube would be thrown away and the towel will be placed into the proper bin. Thank you. After removing my NG tube, I would also document how the patient tolerated it and what secretions came out of my patient. Thank you.